Welcome to the Healthcare Motivation Channel, your dedicated space for inspiration, support, and practical wisdom tailored for every healthcare professional and caregiver. If you find value here, please click like and subscribe so you never miss an uplifting message. And remember to share this video with a colleague or caregiver to encourage them as they provide care for others. Today's topic is how to handle encounters with patients' disruptive behaviors. Every shift, you bring your expertise, empathy, and adaptability to the front lines. But let's be honest, some days it's not the healthcare tasks that test us most. It's the patients whose behavior challenges us, pushes our limits, and sometimes leaves us questioning our own compassion. What is disruptive patient behavior, and why does it matter? Disruptive patient behavior is any conduct that jeopardizes the health or safety of others, impedes the delivery of healthcare, or undermines a culture of safety in the healthcare setting. Disruptive patient behavior encounters are not rare. In fact, nearly 30% of outpatient encounters fall into this category according to the BMJ Open Journal. These patients might express anger, distrust, or anxiety. They may argue, curse, or even become aggressive. Their actions can trigger frustration, stress, and even fear in us as healthcare workers. This stress isn't just a feeling. It has real consequences. A research study reported in the Journal of Patient Safety found that disruptive patient behavior directly increases the risk of medical errors, creates delays in care, and increases staff burnout. When we face these challenges, our adaptability and our commitment to high standards of care matter more than ever. Let's reframe the question. Instead of asking, "What's wrong with this patient?" try a different approach. Let's ask, "What happened to this person?" Ask open-ended questions to gain insight into the root cause that is inflaming the disruptive behavior and address concerns as appropriate. Trauma-informed care gives us the tools to see beyond the behavior and understand its roots. According to a study in the Health Policy and Planning Journal, trauma-informed care training improved staff confidence and reduced psychological distress for over 500 hospital workers. But it is important to know that trauma doesn't just affect patients. Healthcare workers can experience trauma too. When we use trauma-informed care approaches, we protect our own mental health and we create a safer and more supportive environment for everyone. 4. Evidence-based strategies for handling patients with disruptive behavior. Use de-escalation techniques. De-escalation works. It's not just about calming the patient, it's about protecting everyone's safety. A systematic review in Frontiers in Psychiatry Journal found that de-escalation, when combined with other interventions, significantly reduces the need for restraints and improves staff confidence. For example, when providing care to a patient with disruptive behavior, speak softly and clearly. Maintain non-threatening body language. Listen actively and acknowledge the patient's feelings. Offer choices whenever possible. Strategy number 2, setting boundaries. Set firm but kind boundaries. Boundaries protect both you and your patients. Research shows that when healthcare professionals set clear limits, they experience less emotional exhaustion and provide better care. Some examples of setting firm but kind boundaries can include the following. State expectations calmly and clearly. Remain consistent. Don't make exceptions that compromise care or safety. Be compassionate. But don't waver on what's appropriate. Strategy number 3, reflect. Don't take it personally. It is critical for you to understand that patient disruptive behavior is rarely about you. Patients may act out because of pain, fear, or trauma. A trauma-informed care approach helps you separate your identity from their actions. A health policy and planning study showed that staff who practiced self-reflection and emotional processing felt less distress and more control. Consider the following. Notice your emotional reactions. Remind yourself that the behavior reflects the patient's struggles, not your worth. Debrief with a supervisor or manager after tough encounters. Strategy number 4, know and follow your organization's policy because preparation is power. Healthcare settings with clear policies and regular training on disruptive patient behavior see fewer incidents and safer outcomes. Review your organization's policies and procedures regularly. Keep your supervisor updated about any incidents that occur. Keeping your supervisor informed ensures they are aware of the situation and can provide support if de-escalation techniques are unsuccessful. Participate in all relevant training required by your organization. Document and report incidents as required by your organization. Implementing your organization's approved action steps to mitigate the issue and prevention measures can help protect you, your patient, colleagues, and your organization. In conclusion, lead with grace and adaptability. Every difficult encounter gives you a chance to lead with grace. You can choose to adapt, to set boundaries, to reflect, and to act with knowledge and compassion. Trauma-informed care isn't just for patients, it is also for you. By embracing these evidence-based strategies, you safeguard your well-being and elevate the standards of our profession. Thank you for tuning in to the Healthcare Motivation Channel. If today's message inspired you, please click the like and subscribe key. And share this video with fellow colleagues and caregivers to encourage them as they care for others. Stay focused, stay motivated, and we'll see you in the next video.